Hi there. Thank you for joining video 6 in our Revenue Cycle series. I'm Danielle Watson, and in today's couch conversation, ROI's VP of HIS Strategy and Services, Jeff Tennant, joins me for a candid discussion about COVID-19 and its impacts on the revenue cycle. We dig into practical ways to recover, recoup, and establish stability in the healthcare financial world. And if you have not had the chance to view our first 5 videos in this series, take a moment to do that now. Jeff has decades of experience as a former CIO and revenue cycle leader, and his perspective is meaningful. You don't want to miss this.
So, Jeff, I've got some questions for you. As we look at healthcare organizations and their current struggles, what can they do to not only survive, but thrive in a post-COVID-19 world?
Yeah, so in today's times, everybody's struggling. Most organizations are either have been through some significant layoffs or are on the verge of needing to either lay people off or cut some services to get through the downturn in the economy, the slowness of procedures to be being done, just the lack of, people being able to come into the doctor's office, people being able to come in for services. At the same time, organizations are having to focus significant resources, both in people and in money, in the treatment of COVID-19, and having to redirect funding, having to redirect staffing in order to take care of those people that are being impacted by this illness. So in today's world, organizations need to do everything they can to focus on how they can enhance their current revenue streams, and also look at how they're going to recover from this downturn and this slowness in certain procedures, as well as focusing on how they're going to recoup the significant effort and cost that has been spent in the treatment of COVID-19 related illnesses.
Yeah, I think that's great insight. And kind of to piggyback on that, let's talk a little bit about what organizations can do to help their bottom line specifically.
Yeah, so even though when there's a lot going on in the world and everybody's, running in different directions, it's easy to get caught up in things. We still need to focus and keep our eye on the little things, right? The things that seem simple, insurance eligibility verification, making sure that charges are captured, clinical documentation. It's, when organizations are stressed and overworked, clinical documentation sometimes tends to suffer. Right, but focusing on that, making sure that the coders that are integral to getting what happens to the patient onto some sort of billing platform in order to be reimbursed for those services. Those coders need that documentation in order to accurately code, and then that coding needs to be focused on. There are so many new things that coders are dealing with, that they hadn't been, 6 months ago. All the codes for COVID-19, for instance, are, relatively new. They've been out for a couple of months now. There are a lot of things going on in the telehealth world that are codes that maybe coders aren't used to dealing with, used to figuring out the best way to get those onto a patient's medical record. So it's imperative that during this time we focus on the little things and make sure that everything we're doing is being done as close to perfect, with the utmost perfection that we can. If we take our eye off the ball because things are busy and things are strained, the long-term impact of this will be even felt even more, which is something most organizations need to avoid. A lot of organizations are struggling. There's a lot of funding out there, federal funding, state funding, that's being directed toward these organizations. And many of them are doing a good job of taking advantage of that. But there'll be more coming in the future. Making sure they can, quantify what they've done is going to be very, very important. So I think it's very, very important to just focus on the little things, focus on the blocking and tackling, for lack of a better term, and making sure that your organization is operating as efficiently and effectively as it can be in these trying times.
Mm-hmm. I think those are wonderful practical points. Now, I know you've been a former CIO, and you've also worked with financial leaders in health systems for many years. How do you start the conversation? How do you help them to prioritize in blocking and tackling?
That's a great question, Danielle. And as we heard from our roundtable discussion a month back, which I would encourage anyone listening to this, go back and listen to that roundtable discussion. We had CIOs from around the country talking about the things they were doing to do just that, right? To enable and enhance people's ability to continue to do their jobs, to be able to do the things that they need to do. And, in these times of looking for alternate ways of doing business, alternate ways of taking care of patients, technology is playing a huge role. So I think it's important for organizations to lean on their IT departments, leverage what technology is available to them, look for things that are going to make things better, look for things that are going to make it easier for people to continue to do business, enhance productivity of workers, things like that. So I think that's a big part of it, is leveraging the technology that's available. And the other is, making sure your staff, your teams are focused and engaged, and keeping them upbeat in these trying times, which can be very difficult, right? And really encouraging them that everything they do is helping with the long-term viability of the organization that they depend on for their livelihoods.
I think that's great. So let's switch gears just a little bit and talk about telehealth. So we hear that many healthcare organizations have enhanced their telehealth or telemed presence. What does that mean to the industry as we move forward?
Yeah, so the adoption of telehealth is, it's been something that's been out there for a long time, and it is a necessity in today's world. I think we would hear from many organizations that during this pandemic, telehealth has become even more of a necessity, right? As patients haven't been able to travel into offices for office visits and things like that, telehealth has helped fill the gaps. What that's done for many organizations is they have come up with inexpensive, low impact solutions that are getting them through this period of time, but maybe aren't the best solutions for the long term, right? They may not have certain functionality and features. There may be certain things that are lacking in those products, but they still will have a place in the future of telehealth for a lot of things. But I think organizations really need to plan for both the near term and the long term, right? And telehealth initiatives have advanced years in the last few months. So we were talking with one telehealth organization that said, they're seeing, they feel like they've advanced 5 years in the last 3 to 6 months, just in their, where their projections were for new clients, for capabilities, for adoption. And one thing we have to worry about with that type of speed to growth is, sustainability. There's already been several articles that I've seen in Becker's and other periodicals that, talk about, what really is the future, right? Is it one of those things that telehealth fill the gap, but 3 months from now, when things start to get back to whatever normal is going to be, is that going to fall off? Are we going to not use telehealth for the things that make a lot of sense? I believe, referencing the roundtable discussion we had a month or so ago again, there were several of the CIOs were talking about where they've seen significant adoption and really practical future use of telehealth in rural areas and in areas where patients may not be able to have ready access to specialists and things like that. They can leverage telehealth where it makes sense. But I think that's something we need to look at as an organization and as an industry, is technology for the sake of technology. Nobody's ever a big fan of that, but technology that makes sense, makes people's lives, and when I'm talking people in the patient sense, makes their lives easier and physicians' lives better and easier, and also makes the organization's life easier and better. All those things need to be considered as we look at the future and leverage that technology where it makes the most sense, and look for new ways and new areas to leverage that technology. As an example, if someone lives in an area that they may be an hour away from a hospital, or the hospital they need to go to for some specific procedure or some specialist that isn't in their area, you drive an hour to get to the hospital or clinic, you spend 15 minutes to an hour waiting room waiting to see that physician, spend 5 to 10 minutes with that physician and then you drive an hour home. You've just invested 3 hours plus or minus in a 10-minute visit. Most of us wouldn't do that for anything else, but we do it for healthcare all the time. Where that could be handled, if it can be handled through a telehealth environment, you may only invest a half hour in that and also not have the expense of driving. So I think as we look at what telehealth does for us now and what it can do for us in the future, we have to be open-minded. We have to be creative in the way we leverage the technology and use it where it makes the most sense and where it has the most benefit.
And speaking about telehealth and really overall, what do you think healthcare organizations should be doing now to make sure they are ready for the future, for the next phase?
Although there's still a lot of questions out there about what is normal going to be, going forward, and what does that look like, that it is imperative that organizations be able to tap into whatever funding is going to be available out there related to the expenses they've had related to the treatment of COVID-19 related illnesses. Organizations need to be able to capture, quantify, and report on, whatever efforts and expenses were put out in these areas, right? So as they look at what they spent taking care of COVID-19 related patients and illnesses, how do they quantify that? There are organizations out there that I'm familiar with, one being Dimensional Insights, that have built packages, analytical packages around post-COVID-19 discharged patients and going back and really quantifying what that looks like, what in their stay, was cost related to treating that illness, so that organizations have that information available. We have tons of data. We have to be able to turn it into information in order to be able to report and go back and seek these funds that are going to be available for organizations. So that's one thing. The other is, back to the telehealth commentary, is making sure that what you're doing today fits into your long-term strategy, right? Like I said, some organizations took on stopgap measures in the telehealth space. That's great. How do you leverage that going forward? What do you do with that piece of technology that you've already got in your infrastructure now? How do you use that in your broader infrastructure going forward? Where does it make sense to look for new technologies? One of the things that I've always heard is, stressful times, they do not build character, but they expose it. I think that could be put in for an organization as well. Those organizations that were struggling a little bit going into COVID-19 are probably struggling more now. Those organizations that are well run and doing the right things, they're probably seeing less impact. I don't know that there's any real data out there to back that up, but it really is well-run organizations tend to be well-run during crisis. If you're looking around and saying, hey, we're really struggling in this area, well, let's take a look at what the operational piece around that is and look for ways to make that better. So I think it's an opportunity for organizations to take a real deep look at how their organization functions and go back and use this stressful time. As an old IT guy, we used to do a lot of testing, and we would do, stress tests on our systems when we put them in place, and we would simulate, 10 times the users we would normally see to make sure the system's going to hold up and function well with that additional stress on it. It's the same thing with organizations today. If you see that your organization didn't do well with this stress on it, then let's look for those areas and fix those areas going forward. If we don't learn from what's happened in the last 3 months, we're destined to repeat it in the next few years, because our world continues to get smaller in that, people are everywhere. People are all over the world all the time. And, we continue to have warnings of what could be, and, we need to heed those warnings, look at what our plans were, look at how we adapted, and look for those things that really worked best. And as in any disaster, learn from what you had and put those plans in place for the next time. Hopefully there won't be a next time, but history would tell us there likely will be. So there are a lot of challenges out there in the near future for healthcare organizations than in the long term. So as we look at, the population, we have more people unemployed right now than we have in a very, very long time. And there's going to be an increase in the uninsured population out there. Organizations are going to have to deal with that. patients coming in that are uninsured, who many of them for the first time in their lives are uninsured. So they're not familiar with avenues and funding that's available to help people in need. So people are going to need significant assistance in navigating through those channels and figuring out, what funding is available for them, what insurances are available, what assistance can they sign up for, and how do they do that. So that's one area. I think another is, we have people who have been impacted in a way that their emergency funds or their savings have been significantly impacted, not completely wiped out during this time. Those people, if they have some form of an event that's going to cause them financial hardship, the organizations are going to come up with unique and interesting ways to provide funding and payment options and all of those avenues for people to take care of themselves, from a health perspective. So there's a lot in that area, just from a revenue cycle perspective of, how do you make sure that people are able to pay for their services or tap into funding that would help them pay for their services. The other part is looking at telehealth and all of the different revenue codes that are out there, and how can you leverage the things that were there before COVID-19 that were probably underutilized. And then also looking at, how do you maximize the use of that technology and the billing for things that are done in a telehealth environment. Mm-hmm. So that's another funding. The other piece is obviously, the insurance eligibility. A lot of people will be, even those who weren't impacted from an employment perspective, there's still going to be some changes. Some people maybe have changed jobs during this time. Making sure their insurance eligibility information is up to date. So there's just a lot of little things that need to be taken into account as we look at the future and the population of the U.S. going forward, and how do we make sure that healthcare organizations are financially viable to be able to continue to provide the great care that they do for patients.
So Jeff, in thinking about the financial and revenue cycle leaders in healthcare, what advice do you have for them at this time?
Yeah, so as we look at the world today and the future of healthcare and healthcare revenue cycle, in particular, although everything has changed, in some ways nothing has changed, right? At the end of the day, revenue cycle is a lot of great people doing a lot of great work in taking care of patients, making sure they get into the system correctly, working through their clinical days, everything that's done to and for that patient, making sure those things are captured and that you show up on a bill, right? That's, at the end of the day, the blocking and tackling is still very similar. Focusing on things like insurance eligibility, is going to be a key going forward, as we talked about a moment ago, with more people maybe being uninsured or having new insurance or whatever that happens to be. Making sure that you are, as an organization, eligible and ready to tap into whatever funding is going to be provided by the federal and state government related to COVID-19 illnesses is going to be key. So being able to capture and analyze the data and turn it into useful information is going to be very key. So all of those things are very important. And, as organizations look at the future, let's continue to grow from this. Let's not let these lessons fall by the wayside. Let's leverage technology and telehealth where it makes sense. Let's make sure that, we're maximizing our ability to do what needs to be done in a telehealth environment. Let's take advantage of those things that have been out there for years that organizations have been slow to adopt and leverage, right? Let's make sure we're doing the best to take care of our patients and take care of our organizations. I think another thing I would tell organizations right now is, don't be afraid to ask for help. There are a lot of great organizations out there, ROI being one of them, that are here ready to help in any way we can and provide our thoughts and knowledge and what we've been able to glean from numerous organizations, lessons we've learned from helping numerous organizations over the years. So, don't be afraid to ask for help. It's a new world for everyone. We're all learning as we go, but we have maybe organizations have insights from things they've seen other organizations do that they can bring to you and help you, shorten that learning curve and help you not only, survive this crisis, but come out the other side, a stronger, leaner organization.
Wonderful. Thank you for that.